Welcome to the video training for the DOC decompression training for Pivotal Health Solutions. First thing I want to talk about is the placement, preparing the table and the straps for your patient before they come in. The first one is our thoracic belt. We want the center, the thoracic belt about 6 inches from the bottom of the center cushion, right in the middle there. And then we want to bring the lumbar belt up. There are 2 stitch marks in the belt. We want to place those right at the bottom of the center cushion again, slightly overlapping on the thoracic cushion. Also make sure that both sections, the cervical and the pelvic section, those ends of the table are completely flat before you put your patient on the table. And now we're ready for the patient to come and sit down. When your patient comes in, we want your patient to sit right at the top of the pelvic cushion. And at that point in time, we're going to have them lay down and lay back, and they want to be there midsection. And you want the iliac crest hip bone in the gap right here at the center of the table. At that point in time, you can get the pillow or bolster for your patient to make it more comfortable. Comfy?
Yes.
Okay. And then they can also use the leg bolster if the patient would like, for more comfort. At this point in time, we're going to start with the lumbar belt. The lumbar belt, we want to again bring the bottom of the belt across the top of the iliac crest into the hip area. And we want the strap here we can bring back down and bring the bottom of it coming across to make sure the belt is nice and snug. At that point in time, we're bringing up the 2 clips that will come around the patient's waist. And you can tighten nice and snug. Again, with the belts when you clip, again, being right above the iliac crest. With the thoracic belt, we want to form the thoracic belt, and we want to bring the thoracic belt right underneath the rib cage. Where the top of the rib cage, or the bottom of the rib cage, we want to bring the top of the belt, forming a nice cross right in the center of the body. And we're going to bring this across, so forth, just like this. Again, right in the center of the body, where the belts will slightly overlap. Once we have the patient fully secured with the belting system, we're now able to, or ready to target the table. The table itself has a module elevation and targeting button. By the touch of the button, we can elevate the table up to the maximum height. And then we can also, the table itself has a built-in inclinometer. Always remember when you're doing the touch screen with this, the inclinometer itself, each patient will range in variable height. So it's approximate, but it does have a built-in inclinometer. By the touch of this button, we can elevate a certain degree to target, for example, the L5S1 or up to the L1, L2. Once you have the patient in place and you've done your targeting from that standpoint, the table itself also has a capability to laterally flex, to actually open the vertebrae to one way or the other. So if you have a herniation of a disc in your patient, and that's what you need to do to treat your patient, you can actually physically move the table to open the vertebrae. Also, it comes with axial rotation. So again, for certain targeting with certain ailments, you can actually set the table before you do your decompression session. At that point in time, we've got your patient is captured with the belting system. They're actually comfortable with the bolster and the neck pillow we are now ready to tighten the belts. By tightening the belts, all you need to do is you're just going to reach, and there's a loop on the bottom side. You're just going to pull them and lift through. And you're going to tighten the belts, and then also important here is to lift up on the alligator clip just to get a better sink into the belt itself. And then come to the top side, and same thing. We want to tighten here and pull through and lift up on the belts themselves. At this point in time, we're now ready to, we've got our patient set, the belts are nice and snug, and we're now ready to start our decompression session. We've got our patient, they're comfortable, they are now captured with the belting system. We've done our targeting in place, and now we've tightened the belts. We are now ready to start our automatic decompression session. At this point in time, again, back to the touchscreen module, there's a button that says automatic decompression menu. At that point in time, by the touch of the button, you now have 12 different protocols that are at your fingertips that you're able to access. Depending on the ailments that you're going to treat, you would suggest which one you're going to run, and then run your session from that standpoint. Okay, now that we've had our session is over. A couple other things that we want to take care of with the patient itself. You want to go back to the elevating target button with the table. You want to lower the table all the way down to its lowest height. What this being is when the patient gets off, it's a lot easier for them to get off the table itself, instead depending if they're taller or shorter or whatnot. Once the table is down to the end, we are going to release our patient. Now, it's a key that your patient, when you're done with your patient, is to allow them to relax on the table for 30 to 60 seconds, just because of the session itself. We want to also bring the table back to the flat position. Again, by the touch of the button, we can bring the table down and bring that back to the flat position. And they're going to want to just relax and lay here for 30 to 60 seconds, again, just to get just to get back to normal, bring their wits back a little bit from that standpoint. We take the cushion out. Again, they can relax. And then at that point in time, just want to help the patient up. I want to bring them here. And again, have them just sit and relax. And then we're able to, and that would be the end. One of the common things with bigger people is the bigger gut area, and one of the common things that we run across is getting the belts and the capture system in the correct place for that. So one of the things that we've done over time, a period of time, is we use an extender belt that we can use in the extender belt with the lumbar belt, and just by inserting in here, we're able to use that coming across. Now, we also would like to do is with somebody with a bigger, that's a little bit bigger, is to just have them put their hands above their heads before we tighten the belts. What this does is it brings the midsection into proportion. So you again attach the belts into the proper position. You're going to bring the snaps across. Still again getting the bottom of the top of the belts right underneath the bottom of the rib cage, and then again at that point in time you can bring their arms back down, and you've got a nice snug fit right around the midsection of the body. Another common thing that we run across a lot is if we have somebody that's a little bit bigger on the table, and then how do we tighten the belts? If you're CA or somebody that's smaller in the office has to tighten the belts. On the touchscreen, we do have a module, the manual distraction menu. At this point in time, we can do the manual, and what we can do is by the touch of a button, we can extend the table outward and bring the table and retract and bring the table back. At the end of that, so what we're doing is we're going to go to the say the target weight is with our patient. We're going to go out to say 50 pounds. We're going to take the table out to 50 pounds, and then we're going to bring it back. What will happen is the excess slack of the belts will now be at the end of the table, so I don't have to tug and pull tight. It's just a lot easier to snug the belts. Again, lifting up on the alligator clip, we now have our belts nice and snug instead of us having to yank and pull on them to try to get the excess belt underneath that big individual. So when we're using the table for the cervical, most times you're using your table for the most part doing a lot of the lumbar sessions. You do not need the lumbar or the thoracic belt while you do the cervical unit. So you want to make sure that you take your belts off the table. So we take the lumbar belt off, and it's just releasing the mechanism at the bottom to pull the whole post and the belts off the table. And make sure that your locking mechanism handle is pointed back down to the down position. Again, to release, take this out, bring the handle back down, and you can release the belts all together from the table. At this point in time, you're going to insert your cervical headpiece. And the cervical headpiece is very simple, but you have a post, and it's going to insert just in the middle between the two cushions, like so, with your Velcro straps placed down to the sides. At this point in time, we're ready for our patient. And again, we're going to sit right at the top, and then we're just going to rotate them across and right down below. And you want the cushion itself, you want to be right underneath the occiput of their head. So their head's going to fit right in underneath, and again, underneath the occiput. And at that point in time, you're going to bring your Velcro across the forehead like so. And again, now at this point in time, we are now ready to set up and to run your automatic decompression session. The actual headpiece itself, the adjustment of the headpiece is on the back side, and it's as simple as squeezing and pulling apart and moving and sliding your foam, your cushions. And again, just pushing together and sliding out. And there's also a measurement in between where you can adjust to the headpiece. So you can jot down in your notes where your patient was at that point in time. Some additional features of the table. The table also comes with a tilt headpiece that I can tilt the headpiece upward a little bit to get a better capture of with the patient under the occiput. To maybe target a certain vertebrae within the back. And again, simple process of the mech lock button. You're just going to push down to release and so forth. Features on the table. We have the lateral flexion of the table. When you're using the lateral flexion or the axial rotation, make sure you're always using two hands, even if it is easy enough to use one. With the lateral flexion, it is the left side button, your mech lock button. You're going to push and release using both hands. You can, again, lateral to or flex to the left, or likewise to the right. With the axial rotation, again, make sure you're using both hands. Release the tension on the button, and you're able to tilt, axial rotate the table likewise. Table also comes with an additional feature of a printer. The printer itself, at the end of your session, you're gonna there's be a prompt on the module, the touchscreen to print your label. At that point in time, it just comes out, and there'll be a label that would release that you can put into your patient's file. Table also comes with your CD player that you can have your patients bring in their own CDs. So they can listen to relaxing, comfortable music while they're doing their decompression session. Table also comes with a patient stop switch that you can clip onto the belts. That way the patient has it that you can leave the room, and if anything would happen, that they can stop the table in the decompression session by just the touch of a button.